When pandemic hit in March of 2020, as many of you saw from the news, Northwell was had the largest COVID-19 patients that were hospitalized in U.S. So obviously HR played a significant role in supporting Northwell during this pretty extraordinary time. We were moving nurses from one hospital to another to help in the critical areas, and also brought in over 700 additional agency temporary nurses into Northwell. So we needed to have a one global view on the staffing. Our workforce analytics team has developed a prototype in Excel spreadsheet, and they were providing this information multiple times a day to our chief nursing officer. What the new dashboard was able to provide, especially for someone who was making decisions for the entire health system, is to have an outlook on how things looking not only at each hospital, but compare staffing needs and compare staffing ratios between the hospitals. Because of the analytics, we could do many things differently. Number one, we stopped creating huge spreadsheets and turning them into PDF documents and then sending them via email. And then we finally, one day, got a phone call from our chief nursing officer that said we no longer need to meet daily. The clinical situation was more stabilized, and the tools that we put in place were enough, just to look at the data instead of having daily critical meetings. So obviously, the need for reporting, the need for insight continue to grow every day. And this really important data, we're now going to be able to collect in our HCM and bring this data into analytics and hopefully play a major role to help Northwell leaders to understand where we are right now and help them to plan for the future.